Hello, everyone, and welcome to the As a Woman podcast, an initiative by Yebetumi. In this season, we are talking about ending violence against women. And as we say at Yebetumi, we are a very inclusive feminist organization, and we do not leave any demographic out. Today, we'll be talking about violence against women living with disabilities. To do this discussion with me today is Nina Okoroafor. She is a disability rights activist. She also works with the Ghana Federation of Disability Organizations. Welcome, Nina.
Thank you.
I like to let guests, say something about themselves beyond what I have said.
Okay.
So before we get into it, what would you like to say about yourself?
Thank
It can be about your, personal, it can be about work. Yeah.
Okay. So thanks again. In all humility, I am humbled to be here. So like your host said, I am Nina Okoroafor. I have a visual impairment. I lost my sight when I was, 12? I currently work as a social development officer with the Accra Rehabilitation Center. It's an agency under the Department of Social Welfare, Ministry of Gender. I am into disability rehabilitation, organizational planning. I studied social work. And so everything I do is social work oriented, but geared towards disability rehab, disability mainstreaming, organizational planning and stuff like that. Okay, more about myself.
Please, if you have more, please do have.
Okay, so I like to read. I'm a UG girl through and through, both undergrad, masters.
Wow.
I like the Eastern region, Ekopon. I went to school there. I did a Krapiman. So yes, I'm an audition.
Proud old girl.
Yes. I guess I'll stop here.
Yeah, thank you, Nina.
Let me say more and make my head explode.
You probably say more in the course of the discussion.
Okay,
it's warmly welcome. I feel like now we all know you a bit better. This is a heavy topic, and I don't know how softly to get into it.
Yeah.
But let's start with how violence against women living with disabilities look like.
Okay, so first I'll start by saying that violence against persons with disabilities generally has a feel of there's a lot of prejudice in there, a lot of stigmatizing ingredients and discriminatory ingredients in there. Yeah. So most of the violence perpetrated against us, men or women, old or young, are mostly unfounded. In fact, they are all unfounded. They are not rights-based. They are usually, they usually have a religious feel to it. Oh, you're blind, let's pray for you.
Yeah.
Or, oh, you're blind, are you sure your mom didn't go anywhere? Or let's say, if you're blind, then maybe... they begin to ask questions, How long did your mom wait for you? You sure she didn't go to any deity? You sure she didn't promise you for anything and stuff like that? Are you sure she didn't take any alcohol when she was pregnant with you? And it's almost like they want to really fix you as though you're a faulty gadget.
Yeah.
And so, of course, going forward, that's how they relate with you. No, you can't see, then you must be deaf as well. Yeah. If you can't see, then maybe you can't hear as well. So they would ask you, if you can't see, then can you hear? Can you walk? Can you feed yourself? Please help me to the washroom. Should I help you take off your clothes? So all those, and for me, I think a lot of it is around ignorance.
Exactly.
Yes, it's mostly ignorance. But again, people don't want to learn.
Yeah.
They're just stuck with what they know, and they will always go with it until there is a rude awakening. Maybe we'll talk about the rude awakening afterwards.
Yeah, definitely. I've heard a lot of people say a lot of things, but these ones you've mentioned, I'm just shocked by, and it goes to say how how deep the ignorance is. It's
what do you see when you dream?
So invasive.
Yeah. What do you see when you dream? And forgive me, for the men, they ask them, how do you find the way into a woman when you're having sex?
God.
You know, as if those who can see would actually look down there before they do whatever.
Right.
You know,
Right.
it just doesn't make any sense. Yeah. And so the discrimination against women mostly has an SRHR feel to it.
Yeah.
Sexual reproductive health rights. So they see you and you're pregnant, or they see you want to get contraception, and they're wondering why would anyone want to do anything with you at all?
Wow.
You know. So how can a man be so wicked to want to get you pregnant when they know you have a disability? I mean, a lot of things like that. So they wouldn't want to give you a job. They wouldn't want to get you into school because they're already thinking, well, she has that disability. We just can't take her in.
Yeah.
You know, we don't want any trouble. Yeah. So just don't let them come in. And that's how they effectively shut us out. Yeah.
Yeah. Oh dear.
Yeah.
Whew. That's a lot for even me to take in at this moment. You know, would you say that women with disabilities are more susceptible to abuse?
Violence?
Yes.
Twice as susceptible to abuse as normal women. I mean, I am a woman, right?
Yeah.
And so I already know what women ordinarily face.
Yeah.
So add my disability and it makes it even double or triple.
Yeah.
So, not to badmouth men out there, but we do get a lot of bad words thrown at us as women, right?
Yeah.
You want to do politics, they say, you're probably sleeping with someone.
Mm-hmm.
You want to break the glass ceiling.
Yeah.
You know, be an HR manager, be a CEO or manager in a big company. There's something you're probably doing extra than just being who you are. There's always that. Now, let's make this person a person with disability. A woman with, say she's wheelchair bound.
Yeah.
Or say she's deaf or she's blind.
Yeah.
And they're demeaning you even further. Mm-hmm. So in our case, they're not even going to look at you in the first place. Okay? You're not even going to be able to get the skill to get to the point where you want to break the glass ceiling.
Yeah.
If you get what I mean.
Yeah.
So capacity building opportunities are low, educational opportunities, even employment. So this man who wants to give you, Benawa, a job, wants to go to bed with you probably, right? Before he'll give you the job.
Yeah.
And maybe you do it, maybe you don't. But that is the issue around a lot of women trying to get jobs, right? Yeah. So this woman is in a wheelchair and she comes for the job. And maybe if she was standing upright, he will make that pass at her.
Yeah.
But now she's wheelchair bound. And they're just glossing over you. Like, I mean, it's even not a non-starter. Let's not even talk about it. So they're not even allowing you showcase what you can do.
Yeah.
Say or do what you can do. They're just not looking at you twice.
Yeah.
So for school opportunities, employment, even entrepreneurs with disabilities. So you are cooking and everyone is thinking, no. As long as she's blind, I cannot trust how she cooked the food. So I'm not eating. But trust me, a lot of the people out there who cook, they get a lot of things done for them.
Sure. Yeah.
Most people who are driving all around, all the accidents we see, I'll bet you most of them have eye problems.
Yeah.
Definitely. You know. So disability is all around us. If only we can begin to look at it in those terms, I think that will help reduce the discrimination we are facing.
I totally agree.
Yeah.
It's interesting how the food thing you mentioned. I've personally heard someone say there was a woman who is an amputee. I mean, I met in a community and she was selling food, and someone ignorantly said, kwata deɛ, and kwata is not even an amputee, right?
At all.
But the person said in na kwata deɛ, then na wonim w'aduane ho. Like,
can you imagine?
She'll probably, if you buy it, you'd even get her disability.
Can you imagine?
Such an ignorant comment, and I was speechless. But yeah, I totally agree with you, and I have personally witnessed some of these situations.
No.
I can imagine how difficult it can be for women with disabilities to seek redress when they find themselves in discriminatory, abusive situations. You work with a lot of them.
Yeah.
How are they able to seek solutions, to seek redress, be it socially or legally, and how easy or difficult is the process? Are there any tailored intervention?
Tailored? No. There are no tailored interventions that I know of for women with disabilities facing violence. But in any case, if any woman with disability has been violated and she attempts to report to the police, again, the very first reaction will be disdain. Who would want to do anything to her? We don't believe it. Okay, show us the evidence. Did you see the person who raped you? And of course, I can't see.
Yeah.
So I can't describe his face. And so, I mean, I've heard of situations where the blind lady who was raped knew that was going to be an issue. And so she really made sure to hurt the guy very bad. I think she cut him somewhere on his hand or leg or somewhere. So that was the only thing she was able to describe, that I cut him. So look for him. Like, she gave a general description of where he should be and all that. And she knew who he was. But of course, as long as they're going to show her pictures and she can't point to one, she can only give her descriptions. And eventually they got him because of the description of the cut that she described, she gave of what she did to him. A deaf lady, for instance, was being sexually abused by a guy. And anytime he came to abuse her, he did sign language. Told her, don't tell anyone, I'll marry you, blah, blah, blah. Yeah. And the guy always chewed gum. I don't know why. But for some reason, the lady felt that was a way for her to get
DNA.
I don't know. No,
like
not evidence.
Yeah.
So anytime she came and he was ready to start, she requested that he took out the gum and then she stuck it at the back of her bedboard. So there were so many of them, And so when it got to time for her to make her complaints and reports and everything, the guy was denying. I never did that. I never went there to her house. And then she asked them, do they know he always chews gum? They say yes. So come, let me show you. They went there, she shows them the gum and all that. So it's up to us ourselves to protect ourselves.
Yeah.
Because out there, there's a statement I've never liked: no mercy for the cripple. And even those who don't say it actually act it out. There is no mercy for women with disabilities. There is none. You need to basically be your own protector.
Yeah.
Yeah.
You've spoken a lot about how it happens in the legal system. Let's talk about access to healthcare. Let's talk about employment. Let's talk about just participating in society, social life, religious settings.
Okay.
Are there any interventions to address the discriminations and abuses women with disabilities face in these areas?
Okay. So starting with healthcare, I know there have been a bit of training, advocacy to the Ghana Health Service and the Education Service for some form of sign language interpretation to be part of the nursing training module.
Sure.
And so you're a nurse or you're a nursing student and you're going to school for 4 years. I mean, how many things do we even learn from the beginning? Do we remember?
Yeah.
But you're teaching them sign language interpretation for just 1 semester out of 8.
Sure.
And you expect them to be very good communicators with deaf people who come to the hospital. So a deaf lady, a friend, goes to the hospital and she's in distress. She's rubbing her tummy all over. And they interpret it as, okay, she has a tummy pain. And they give her a drug and she miscarries.
Oh.
Yeah, she miscarried. So I'm trying to say that even the sign language interpretation that some nurses are taking, it's not enough.
Yeah.
It's not enough. Persons with disability, especially women, so we go to the hospital, antenatal, and they make all those comments. Honestly, they do.
Yeah.
Into wonyam, into what saying, and they're asking all those questions, and you feel like maybe I should just have stayed home.
Yeah.
Or they're making comments as though, well, how sure are you your baby's not going to be like you? Since you know the problem you have, maybe let me use tree. I was also so, you should have pity on yourself, not to want to bring another life. Yeah. So then they're effectively rubbishing our sexual reproductive health rights.
Yeah.
So it's for all of us to answer. Does my disability invalidate me from enjoying my sexual reproductive health rights? There are no special interventions for women with disabilities in the hospitals. No, I don't think there are. I think the hospital system sees every client as ill, right? I mean, you must be ill to go to the hospital. And so it just so happens that some appear to be more ill than others. But there are issues of poor confidentiality, stuff like that. So I go with my assistant to the hospital and the doctor insists my assistant must be in the room while I consult with him.
Yeah.
I think I am the one who needs to determine if I want my assistant to be there in the room while I tell the doctor that I have an itch in a sensitive place. Don't I have to choose?
Yeah.
Or they give you a prescription, a medical prescription or a medical diagnosis, and they're giving it to your assistant or they're reading it to your assistant to tell them, this is what she has. And so take her to the drugstore and let them give her this drug.
Yeah.
I don't know what I have because the doctor decides that I don't have capacity to know. All right. So they're giving my guide medical, medicines, and they're telling him, okay, so let her take this one 2 times daily, 3 times daily. So what if that assistant is not available? How then do I take my drug? I consulted with a few doctors, I do have medical students who come to my office from time to time. And so I told them that instead of telling the assistant what to do for the person with disability, tell the person with disability how to be able to identify them.
Yeah.
So you see these drugs, this one is bigger. It has these lines on it. Okay, so you take this 2 times a day. And stuff like that. So that, of course, it always helps that other people around can help. But what if they are not around?
Yeah.
Then you asked about social life. And you know me, I'm quite curvy.
Yeah.
I dress very nicely comfortably when I want to go out. And people are wondering, why am I doing that? Is it because I want to attract anybody? I say, excuse me, I have a right to dress how I feel.
Yeah.
So that I feel comfortable.
Yeah.
I don't need anybody's eyes as permission, to dress the way I want to.
Yeah.
And so a lot of blind girls on campus would dress very well and everyone is thinking, how can a blind girl dress like that? It's not appropriate. So we are blind, so we should wear overalls,
Yeah, I mean, how is that?
Yeah, so when we don't look, the idea is that we don't have to make ourselves look desirable. Yeah, because no one will desire. So we should just be in our one corner. Yeah. Of course, there's still a lot of myths out there that disabled women, and listen very carefully, disabled women are cures to HIV. So they would rape you so they could get cured. Yeah. Wow. And so for homes where they don't think that their girls with disabilities should go to school or get a job or learn a trade, keep them at home.
Yeah.
Have the girls there without capacity to protect or defend themselves when these men come in to have sexual intercourse without their consent.
Wow. That actually kind of addresses a question I was going to ask. I would just ask that, and maybe we can add your response to that as well.
Okay.
Would you say that women with disabilities are targeted by abusers?
Oh, yes. Yes. Yes, absolutely. So they think you cannot defend yourself. So then let them they will just pour their abusive nature on you. Yeah. So they do target us, especially when they know, in the mind of people who are quote unquote sick that way, who go about making their business to perpetrate sexual violence or gender-based violence against people. They look for baby ajo, right? Someone who cannot defend themselves.
Yeah.
And then they go all out on them. So for people like us who can speak, I can't see you, but I can talk.
Yeah.
And I have a lot of resources at my hand. They will dare not come to me. But they will go to someone who has limited education, limited capacity. They can't speak for themselves and stuff like that. They're home. I mean, if they say someone came in here to rape me, no one will believe them because of the mentality of the people around them themselves.
Yeah.
Right? So, nothing else will come, out of you anyway. So if someone is going to rape you and all you're going to be good for is to make babies, then that will be better.
Yeah.
So I tell you a story of a young girl, blind girl, who her mom was always, very bitter, right? Because she was the only child the woman had. So you are my only child and you're blind, and everyone is laughing at me that I give it to a blind girl. I will see to it that I prove them wrong. And guess how she saw to it?
How?
She encouraged her daughter to start early sex.
Wow.
Do it very well. And of course, the girl grew up to like it. Yeah. So she grew up to like it. And as we speak, she has about 4 or 5 kids. None of them is blind. And the woman feels vindicated.
Oh my.
Yeah. I told you my children are not going to be blind. That was just a mistake. See all my grandchildren? 5 of them. And they can all see.
That is so...
Yeah.
That's so abusive.
Yeah. But of course, her mom wouldn't see it that way.
Yeah, that's if probably starting early means before 16. So she had the child defiled.
Yeah. Yeah, she actually had her first at 15, and it just kept going on and on. And there are those whose parents, realizing how sexually active the girls are, will go and arrange with some nurses and things to put her on some kind of family planning or some kind of medication without their knowledge.
See, when we talk about abuse and violence against women with disabilities or persons with disabilities, people think it's always the physical ones, like the raping, the hitting, the slapping. All of these, I would say, for want of a better word, soft abuses happen. The verbal abuses happen.
Emotional.
The discriminations, the emotional, they all happen. This is a direct infringement on their right to, sexual reproductive health. Right, I mean, to decide what they want for their bodies, but you're going behind their backs, getting them, putting them on methods that they have not signed up for. And that in itself is abuse.
Sure.
I mean, it's, I don't want to say, it's not sad, it's an injustice that we leave women with disabilities to themselves, to protect themselves. We are not putting structures in place to ensure their safety, to protect them, to have them educated, to build their capacity so they're able to better participate in society.
Yeah.
We are not making structures disability friendly so they can have access to. It goes on and on and on.
I'm happy you talk about structures.
Yeah.
So I know of a lot of young girls who are working in a formal space, wheelchair bound, use crutches and everything, but they don't have access to accessible washrooms.
Yeah.
And so, I mean, the general thing is that, they're disabled, they're not going to be productive, stuff like that. Now, this is a girl who wants to work genuinely, but the washroom is a necessity.
Of course.
Okay. So the washroom is not accessible. And anytime she gets there, she needs to park her wheelchair outside and crawl into the washroom with her hands on her hands and knees, do her thing,
horrible.
Crawl back out and stuff like that. So she also decided that when is that time of the month, she was only going to do a half day.
Of course.
Yeah.
But she was penalized at all.
Yeah, she was penalized for it.
See,
yeah,
this is a form of abuse. Mm-hmm. This is violence.
Okay. So you're already not providing for me what I need to work well, and you are punishing me for my adaptive measures.
Exactly. That's an injustice.
Yeah.
It's been a really interesting discussion, Nina. Very heavy, very sad, very, I don't know what other word to use that describes how horrible our society is towards women with disabilities. Let's wrap up on recommendations. We've talked about the challenges. We've talked about the inadequacies. We've talked about the gaps. Yeah. For you as a woman with disability and a person who works with persons with disabilities and an activist, what changes do you want seen? What do you want done from local level to national level to families, to societies? What do you want to see happen to create a change to end violence against women with disabilities?
Great. I'd like to start from home, from the family level. I'd like to tell all parents out there who have children with disabilities to look at the bright side, identify, recognize that your wards with disabilities can amount to something. And once you start on that basis, you would know that there are so many places where they can go get training, education, and then they'll realize their full potential. Once you start speaking to them, encouraging them, building their confidence and stuff like that, you invariably increase their ability to withstand or resist or prevent or seek for redress when it comes to sexual gender-based violence. And be the champions of your children.
Yeah.
Be the champions of people with disabilities in your community. Where I used to live in Kanda, oh my. Everyone in the area knows me. They see me on TV and everything. And so when I'm coming home in an Uber and the Uber driver doesn't want to, follow my direction and they see me and they're like, Uber driver, this is the way they direct you to my house. No one will tolerate anything in the middle of the road because they know that Nina might come by.
That's awesome.
So our communities need to be part of championing our cause.
Yeah.
All right. And then the government. Right?
Yeah.
Okay. So there are a lot of laws government claims to have made, but are not implementing.
Yeah.
We should have a disability law, Act 715, 2006. 2006. This is what? 2024.
Yeah.
That law still does not have a legislative instrument. And so we know what the law says.
Yeah.
But we don't know, even the lawmakers themselves do not know how to implement them.
There's no implementation plan.
There's no implementation plan. So, say one of the provisions of the law says that people should refrain from derogatory statements, remarks. Yeah. Otherwise, there's a penalty term, all the nice legal languages.
Yeah.
But we're in this country, we've all seen Shatawale insults and abuse stoneboard.
Yeah.
Yeah. It's not going to go anywhere. So bring that down to an ordinary blind lady, an ordinary deaf person, a person with albinism. We all call them free.
Yeah.
And we're hurting their feelings because they do have their names.
Yeah.
Their name is not Ofri. Their name is not Apache. Their name is not Nifreni. They have their names. Ask them what their names are and let them tell you how they want to be referred as.
Here.
So these laws, we're trying to reenact a new law. It has still not got to Parliament. We hope they do come round to passing that law. So we have basis to seek legal redress when discrimination and, all these illegal things are perpetrated against us. And then CSOs. CSOs like Yebetumi and all of them. I like what Yebetumi is doing. Yebetumi will really go all out to ensure inclusivity. But how many Yebetumis do we have out there?
Yeah.
All these discussions you're having. You could have easily done one without women with disabilities.
Yeah.
But all the CSOs out there, most of them will say, well, we are women. They are persons with disabilities. Excuse me? Am I not a woman as well?
Right.
And so when they are implementing all their programs or even drawing their programs, they should have at the back of their mind all the different diversities of the target groups that they have.
Absolutely.
So identities do intersect.
Yeah.
There are women, there are blind women, there are poor blind women, there are poor women.
Yeah.
So let's think of intersectionality in our programming, especially around, women, disability, SGBV interventions, so that when we are going out to schools and teaching girls how to protect themselves, how to evade all these SGBV advances, we do recognize the special schools as well.
Yeah.
That there are special girls who need those training in accessible formats. So you cannot definitely go to a deaf school and stand and talk and no one knows what you're saying.
Yeah.
You must have sign language interpretation. If you are printing documents, you're making infographics, make them accessible. So blind people who know how to use screen readers will be able to access them. Print some in Braille. So those who are in school who read Braille will read it as well. Use other languages. We don't all speak English, for crying out loud.
Yeah.
Use other languages that the people can access. And I'm sure if we all do this in our own small way, it will come together to reduce SGBV against women and girls with or without disabilities.
Whew. Thank you so much.
It's a pleasure.
This has been enlightening. It's been educative. And for me, and I'm hoping it's been enlightening and educative for everyone watching or listening to us as well. Women living with disabilities are not an anomaly. They are not a defect. They are not born a mistake. They are not easy targets. Our society, as individuals, our policymakers have made them vulnerable to abuse, but that doesn't mean you should go out of your way to be abusive, to be discriminatory, especially for employers. And this is very important because we live in a capitalist world. We live in a very patriarchal world where wealth is centered in the hands of men, and a capitalist world where money runs things. And if you are keeping persons with disabilities from employment, you're basically making them even more vulnerable to abuse and to all other forms of injustices. And so I'm wrapping up today. Nina, do you have any last words? A second.
Maybe I'll just wrap up by saying that issues of disability and non-disability should not be treated as us against them. So they think that, well, they are disabled. What do they want? And then we will think about it if we want to give it to them or if we have reserved resources for that. But disability, it hits everybody. A friend once said that disability is a club. It's a very open club.
Yeah.
So anybody can join at any time.
And
just fall sick, just get malaria today, sleep and wake up, and you could easily be blind.
Exactly.
Scary, right?
Yeah.
Get an accident, and let's see if your legs will work, if you have that much money. And so anything could happen to anybody. So the earlier we see disability as part of us and create interventions that are inclusive, takes care of everybody equally, maybe when it's your turn, you're not going to suffer much.
Yeah. Create an empathetic world, and when it happens to you, people will be more empathetic.
Absolutely.
But it doesn't have to be, you don't have to treat women with disabilities better because you're afraid that you may end up in that situation. Treat them as full human beings with rights, with, who are deserving of respect and dignity as you treat any other person. I've been speaking with Nina Okoroafor. She's a disability rights activist and also works with the Ghana Federation of Disability Organizations. women with disabilities are full human beings. They are not defects. They are not mistakes. They are not problems that need fixing. This has been the As a Woman podcast, an initiative by Yebetumi, and this season is the Solidarity Against Sexual and Gender-Based Violence season. Today, we've spoken about violence against women living with disabilities. We are going to come your way again with another episode in this season. Till then, take care. Get interactive with us on our socials at YebetumiGH on X, at Yebetumi on Instagram, and our website is www.yebetumi.org.
Bye.